Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A patient with type 2 diabetes on insulin becomes pale, shaky, and confused during a gait training session. What is the most appropriate immediate action for the therapist to take? Option 1. Stop the session, have the patient rest, and resume once symptoms resolve. Option 2. Stop the session and provide a fast-acting carbohydrate. Option 3. Stop the session immediately and call 911. Option 4. Stop the session, document the incident, and reschedule for another day. Patients with diabetes are at risk for hypoglycemia during exercise, as exercise increases glucose uptake by muscles. The patient is demonstrating signs and symptoms of hypoglycemia, pale, shaky, and confused. Recognizing and responding to hypoglycemic episodes quickly is a critical skill for physical therapists. This patient is on insulin, which already lowers blood glucose, and is now exercising, which further drives glucose into the muscles. That combination creates a perfect storm for hypoglycemia. The symptoms described, pallor, shakiness, and confusion, are classic early signs of a dropping blood glucose level. Your job as the therapist is to recognize this pattern immediately and act. The question is asking what the most appropriate immediate action is, so let's evaluate each option through that lens. Let's explore each of the options. Option 1. Stop the session, have the patient rest, and resume once symptoms resolve. Stopping the session would be appropriate given the patient's symptoms. However, resting alone does not treat hypoglycemia. Blood glucose levels will not recover without a carbohydrate source. Resuming the session before the root cause is addressed puts the patient at further risk. The body cannot self-correct a significant glucose drop simply by stopping activity, especially in a patient on insulin, where exogenous insulin continues to drive glucose down regardless of whether the patient is exercising or resting. This option also introduces the dangerous idea of resuming the session once symptoms resolve, but without treating the underlying cause, symptoms will not resolve on their own. This option is incomplete and potentially harmful. Option 2. Stop the session and provide a fast-acting carbohydrate. The session should be stopped, and the therapist should provide a fast-acting carbohydrate to the patient. A fast-acting carbohydrate addresses the immediate drop in glucose level and should resolve their symptoms. Fast-acting carbohydrates, such as glucose tablets, fruit juice, or regular soda, are rapidly absorbed and quickly raise blood glucose levels. This is the standard first-line intervention for a conscious patient experiencing hypoglycemia. The patient is still conscious and able to swallow, which means oral carbohydrate administration is both safe and appropriate. This is the rule of 15 inches in action. Give 15 grams of fast-acting carbohydrate, wait 15 minutes, and reassess. Option 3. Stop the session immediately and call 911. Calling 911 is premature for a conscious patient showing early hypoglycemic symptoms. It becomes appropriate only if the patient loses consciousness or symptoms do not improve after intervention. This option reflects an overreaction to the clinical picture. Calling 911 as a first response bypasses the simple, fast, and effective treatment that is available right now. That said, and this is important, if the patient loses consciousness, cannot swallow safely, or does not respond to carbohydrate administration, then calling 911 becomes the correct next step. Know when to escalate, but don't escalate prematurely. Option 4. Stop the session, document the incident, and reschedule for another day. While rescheduling the patient may eventually be appropriate, the immediate priority is treating the hypoglycemic episode. Documenting the incident without intervening first neglects the patient's urgent clinical need. Documentation is always important, but this option essentially ignores the hypoglycemic episode and moves on, which is a serious clinical error. Document after you treat, not instead of treating. Rescheduling may be a reasonable downstream decision, but it has no place as an immediate action when a patient is symptomatic right in front of you. When we look at all 4 options together, the pattern becomes clear. Options 1 and 4 both fail to treat the hypoglycemia. Option 3 escalates too quickly for a conscious patient. Only option 2 directly addresses the root cause with the appropriate, evidence-based intervention. The correct answer is option 2. Let's explore the all-student data. 86% of students selected option 2, stop the session, and provide a fast-acting carbohydrate, the correct response. 9% of students selected option 3, stop the session immediately and call 911. 3% of students selected option 4, stop the session, document the incident, and reschedule for another day. 2% of students selected option 1, stop the session, have the patient rest, and resume once symptoms resolve. This question is an other systems question, which represents approximately 18% of all exam items. This question is an interventions question, which represents approximately 26% of all exam items. This question is a Level 3 question, since the question requires candidates to systematically analyze and often interpret information to determine an appropriate course of action. The questions tend to have some degree of subjectivity, and candidates are required to assign varying degrees of importance to different variables. Looking to review related academic content, check out page 542 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.